God! Look at this room! I wish you could stand here next to me. Look at all these people, these beautiful, beautiful people! Oh, I just want to take it in for a minute. And thank you to these co-chairs for their incredible work getting so many of you in this room. We couldn't do it without you. I'm literally overwhelmed. I think I have no words. No, everyone who knows me knows I always have words. Anyway, I am so excited to welcome all of you to our 2022 Champions of Choice Luncheon. I really, truly can't thank you enough for being here. It means the world to me. When we last came together in this room 3 years ago, none of us could possibly have envisioned what we would be through, how much we would go through. I mean, let's face it, we've been through the ringer, right? I mean, we've seriously been through the ringer. Surviving a once-in-a-lifetime pandemic, an attempted coup, a relentless onslaught of regressive legislation all across the country. But we are still here, we're together again, and our resolve is stronger than ever, is it not? I am so grateful to the Benefit Committee for this event. We could absolutely not have done this without you, and especially these incredible co-chairs that we have had such an honor to work with. I also really want to recognize my tremendous, supportive, passionate, committed boards of directors for the National Institute for Reproductive Health and the NIRH Action Fund. Will you wave or stand or something so you get some much-deserved kudos as well? It is so wonderful to welcome back so many friends. I saw some of you as you were coming in, and then I had to hide back there, and it killed me not to be able to spend more time with you, so I hope to see every one of you I can while we're here together. There are also quite a few previous champions of choice here. Caroline Hirsch, woo! Cindy Levy, Rabbi Robert Levine, Margaret Munzer-Loeb, who's cold like I am, wrapping up, and Liz Winstead. Woo! And I'm seeing so many new faces. Can I get a hand if you are here for the first time? Look at that. That tells me that we're onto something here. Thank you, thank you, thank you for being here. So, speaking of being here, I'm guessing that many of you came today because it feels like we are basically on a cliff, about to plunge into a crisis for abortion access that will pose an imminent threat to public health and a grave danger to our basic fundamental personal freedoms. Now, I'm not going to spend my whole time up here with the doom and gloom. We all have all of the gizmos that tell us all the doom and gloom all day long. But I do want to briefly set the stage. Let's face it, we have a Supreme Court packed with zealots who are ready to turn their backs on women and everyone, basically, and precedent, of course. Let's not forget that. We have states doubling down on banning abortion, not content to wait for the Supreme Court to give them the green light. They're just going. And we have borne terrible witness these last 8 months of what's happening in Texas, where a vigilante abortion ban decimated access after 6 weeks. And I want to say to the people of Texas and in states that are so under siege, like Arizona and Florida and Georgia and more, we see you. We're here to help our partners weather this immediate storm, and I promise you, together we are playing the long game to turn this around, because I know we will and we can. But, you know, true talk, folks, it's going to get worse before it gets better. That's a fact. And yet, I am up here because I still have hope. And the reason I still hope is I believe the real reason you're all here, and the real reason I'm here, is because we are answering the call to fight back, to change what's happening, right? That's why you're here. That's why I'm here. We understand that our rights, our ability to control our bodies, our lives, and our futures really are determined by what happens in the states. We know there has never been a time more suited to what we do at the National Institute for Reproductive Health and its Action Fund. Because we fight for just and equitable access to reproductive health care, passing good laws where we can, and building political power for the future for reproductive freedom in the states. That has been NIRH's bread and butter for years. We didn't just discover it, we've known it all along, and it's why we've been doing what we've been doing. And where there isn't yet the political will to make change, we help elect the people that we know will make it happen. And we do all of this hand in hand with the groups on the ground who are there day in and day out to hold people accountable and make a difference in people's lives from coast to coast. And thanks to all of your generosity, we are making a real difference, I promise you. And I will get to some of those details in a minute. Not too many details, I promise. Just enough to go home and feel inspired. The first thing I wanted to do, though, is I've been thinking a lot about the past, too. Especially wanted to share a lot of thinking about when I first started working for reproductive freedom, first got into this fight. It was 1989. I know, do the math, fine, get it over with. The Supreme Court had signaled that it was ready to overturn Roe versus Wade. They were just waiting for a state to bring it the right case. And conservative legislatures and governors were tripping over each other to be the first up at bat. That might sound a little familiar, huh? Now, back then, I had just started my first out-of-college job. I'd had jobs before that. As a secretary for abortion rights attorneys. Thank you, Mom, for making me learn the piano, because I typed really fast. So by day, I typed briefs and I transcribed dictation, and by night and on weekends, my friends and I took to the streets. We put our bodies on the line, and we taught ourselves and others how to safely perform an abortion without a medical provider. Because we feared the time was coming when access to abortion care in a healthcare setting would be the luxury of the few. And we were ready to take matters into our own hands, just as people have done throughout the centuries, and just as the Jane Collective did in Chicago right before Roe. Another shout out to Caroline for bringing that story to the big screen 3 years ago. She could not have been more prescient. So here we are. And by the way, the name of that movie is Ask for Jane, and if you haven't seen it, you must. Okay, commercial done. So here we are, nearly 50 years since Roe versus Wade made abortion legal nationwide, bracing for a devastating Supreme Court ruling this summer. And I get asked a lot, so Andrea, are we going back to the bad old days, the way things were before Roe? You may be wondering that same thing, so I thought that was an important thing to talk about today. My answer is, it will be similar, and it will be very, very different. So what will be similar? There will be no federal protection nationwide. And be on the lookout. This Supreme Court, they're going to try to hide the ball. They're going to try to have a whole lot of legal jargon because they know how popular abortion access is, and they get that this is an election year. So don't be fooled by that. Because I'll tell you, about half the states will take whatever they say as an invitation to start those bans in place that haven't already gone into effect, and to continue to encroach on all the other freedoms, trans rights, voting rights, access to contraception, and the full range of reproductive health care. Law enforcement will sadly feel more emboldened to go after healthcare providers, to those needing pregnancy-related care, and to anyone who's helping them. And the impact will be widespread across age, race, income, geography, but the greatest toll we know will be for those working to make ends meet, for communities of color, young people, and those living in rural areas. Okay, that's the downer. Let me tell you what's the up. What's likely to be very different. We must and should and can celebrate the fact that over the last 50 years, we have together built a stronger, more diverse, more dispersed cadre of healthcare providers, legal experts, advocates, grassroots organizations, and so many champions, including all of you, who are willing to speak up without shame and who are ready to fight for reproductive freedom for everyone. We also have the benefit of a simple yet profound advancement in reproductive health care, medication abortion pills, right? Now, we know these have been proven safe and effective. They have been used by millions and millions and millions and millions of women around the globe. And, as many of you may have been learning, they are safe and effective when taken in consultation with a healthcare provider or not, as long as you have the information you need, someone to ask questions of, and access to the medication itself. And more of that is becoming possible. And here's another major difference, and one that you all should be deeply, deeply proud of because you helped make it happen. Before Roe, only 2 states on the US mainland had passed laws to make abortion legal and available. Today, we have 17 states and the District of Columbia, right, that have enshrined abortion rights into their state law. Too bad, Supreme Court, take that. or repealed their pre-Roe abortion ban so they won't take effect. And half of those changes happened in the last 3 years. And I'm so proud that NIRH and the NIRH Action Fund played a key role in every single one of those wins, including the new projections in New Jersey and Colorado that passed in just the last few months. That's because we have been working away in the states tirelessly to build the coalitions, draft the legislation, create the advocacy campaigns, train our partners and elected officials in effective messaging, and of course, to elect the candidates who will champion these issues. That's how we get this done. And so since we've last gathered here, we've also wiped off the books things that people thought you couldn't do, like let's get rid of parental consent requirements in Illinois and Massachusetts. Done, right? Let's get rid of the mandatory delays and trap laws in New Jersey and Virginia. Done. And we continue to counter the crisis in Black maternal health and inequities in access to contraception, knowing these disparities will only get worse as abortion is banned and facilities are closed. So this past year, we helped to secure increased access to doulas in Rhode Island, to address health disparities in Connecticut, create state-funded reparations for those who were sterilized while incarcerated in California, yes, California, recently, and increase access to contraception in Mississippi, Pennsylvania, and Wisconsin. We're also at least doubling the capacity of the grassroots groups I hope you have heard about, known as abortion funds and the practical support networks that help those needing abortions get them and get to them. And the work we do is we help them secure local funding in places like Austin and Kalamazoo and New York City and Portland, Oregon. And we have more cities online this year. And now we're taking it up a few notches. We just worked with our partners in Oregon to make that the first state to allocate funds for abortion as part of an historic $15 million reproductive health fund. It's remarkable, and we are now working to get New York and New Jersey and others to follow suit so that you can get an abortion no matter where you live, because the states that have it legal and accessible, we got you. All right? So finally, one last difference between today and the days before Roe versus Wade. 3 generations have come of age knowing that we have the right to make our own reproductive decisions. We have organized our lives around the assumption that we can decide whether, when, and with whom to have children or not. And I truly believe there is no putting that genie back in the bottle, right? Come on. We have an electorate that is waking up to the attacks on our rights, our autonomy, and our humanity. We have more and more elected officials who are willing to stand up for reproductive freedom unashamed and unabashedly. We have historic firsts who will shape a different future with us. From the Vice President to the Supreme Court, I am holding on to that joy, and I hope you are too. To the top elected office here in New York State. Spoiler alert, there's something later in the program, or perhaps I should say someone. We have courageous individuals who have dedicated their lives to providing abortion care, like Dr. DeShawn Taylor, one of our partners and one of our honorees today. We have more and more prominent individuals with huge national audiences who are willing to use their platforms to speak out, like our other 2 honorees today, Amy Schumer and Cecily Strong. And last, but by no means least, we have communities of activists, advocates, voters, people like all of you and so many more all across this country who care deeply and are springing into action to ensure that anyone who wants and needs reproductive health care can access it, no matter what the Supreme Court does. That's what gives me hope, because I know together we are ultimately unstoppable, right? Come on, give yourselves a hand. Let's take the inspiration from seeing each other, being with each other, advocating alongside each other, carry that forward into what I know will be a better, brighter, more just future. Thank you so much for being here.